discuss a case of routine ANC, and for that we have Dr. Asmita Pandey. She is from Guru Mishri Homeopathic Medical College, Jalna. I will request to Dr. Asmita, please share your view. Dr. Asmita? Dr. Asmita, please share your PPT. Today we have two experts, Dr. Pragnya Deshmukh, Professor and Head of OBGY Department, SMBT Ayurvedic College, Igatpuri. And second one is Dr. Trupti Devrukkar. She is Professor and Head, Gynec Department, Srimati CM PHM Homeopathic College, Mumbai. And we have PG scholar, Dr. Asmita Pandey. She is from Guru Mishri Homeopathic Medical College, Jalna. Dr. Asmita. Please share your PPT. Yeah, your screen is visible. Please share your PPT.
Ma'am, 1 second.
Today this is last case of ANC. From next meeting, we are going to start diabetes mellitus. For that, we have certain cases from various colleges of Maharashtra. various faculties like Ayurveda, Homeopathic, nursing, physiotherapy. We are going to present cases of diabetes mellitus from next session. Today, this is our last case. अस्मिता काही प्रॉब्लेम आहे?
Yes, ma'am. I'm trying to present, but हो नहीं रहा है. एक सेकंड ना मैम.
तिथे खाली ग्रीन टॅब आहे स्क्रीन शेअरचा, त्याला क्लिक कर. आधी तुझ्या जे स्लाइड्स आहेत त्या ओपन करून ठेव.
Just 1 second, ma'am.
हो 10 किलोमीटर लाईन लागले तर.
जमतंय का तुला की मी करू?
मैम 1 सेकंड में ट्राई करती हूँ. नहीं हो रहा है तो फिर
हाँ ठीक है.
देखते हैं.
Background of the day. We are here and the
लेक्चर जॉईन करा.
theme for this year is Ayurveda for student, Ayurveda for healthcare, Ayurveda for farmers. So this session is for students, Ayurveda for students, and we are going to discuss whole picture of ANC related with Ayurveda, etiology, pathophysiology.
जॉईन करा.
Dr. Asmita. Dr. Asmita.
Yes, ma'am.
May I share?
Yes, ma'am. Please, ma'am.
Is it visible?
Yes, ma'am. It's visible.
Okay. So please start.
Hello, everyone. So today I am going to present on ANC case visit. So, ma'am, next. 30-year female patient came with a complaint of abdominal pain and weakness. So there is a history of aim and 1 second, ma'am. Ma'am, I've given last wala PPT. Please share that.
नहीं. This is previous one.
Last. I've sent it right now. मतलब few minutes ago.
No, please continue with this only. Okay,
Sorry, ma'am.
please continue with this current PPT.
Okay, fine, ma'am. So, 30-year female patient came with the complaint of abdominal pain and weakness. So, there's a history of amenorrhea since 9 months. There's no history of PV discharge, no history of bleeding from vagina, no history of vomiting, headache, backache. Past health history, there's a childhood illness, not significant. Past surgical history, nothing specific. She took the TT immunization at the 4th and 5th month from the local primary healthcare center. Menstrual history, she have attended menarche at the age of 14 years. There's no dysmenorrhea during the menstrual cycle. She is having a 30-day cycle. LMP was 10th of October 22 and EDD which is expected to be 17/7/23. Next is obstetric history. Gravida is 2, parity is 1. There's no abortion, one living children. So history of first trimester, she does not have any history of fever, rashes, burning, maturation, any X-ray exposure. There's only history of minimal vomiting and headache during pregnancy. There's no history of epilepsy, diabetes, BP, or twin pregnancy. And in second trimester, she have experienced the quickening at 16 week of pregnancy. There was thereafter she could appreciate the fetal movement regularly. At third trimester, USG abdomen have done at 7th month, and pregnancy was uneventful. General examination, her height is 146 centimeter, 53 kg weight. Build is moderate. Nourishment is she is moderately nourished. Pallor is present, minimal. There's no icterus, clubbing, pedal edema, or lymphadenopathy. Vital sign, her BP is 120/86, RR is 20 per minute, pulse rate is 86, temperature afebrile. On breast examination, there's no tenderness, breasts are not engorged, no distended veins are visible, areola is pigmented, nipple is enlarged, erectile, and pigmented. There's a secretion present, no inverted or cracked nipple. In respiratory examination, the normal breath sound can be heard all over the lung field. CVS S1, S2 heard, there's no murmur. Central nervous system, there's no focal neurological deficit can be appreciated. In abdominal examination, inspection, abdomen was distended, umbilicus are stretched and centrally placed, linea nigra was present, stria gravidarum was present, so there's no scar marks as such. On palpation, the fundal grip at the sternum, regular parts were palpable, right and left lateral grips, back and fetal part were appreciated, fetal movements are felt. On auscultation, normal bowel heart sound can be heard. FHS was 140 per minute. Fetal heart sound heard at right lower quadrant as 140 beats per minute. Per vaginal examination, there was no discharge per vaginally and os was closed. These are few investigation, that is CBC and USG knuckle scan. CBC has done initially and knuckle scan at the 16 to 18 weeks we have done. Thank you.
Thank you, Asmita. Now we have Pratya Deshpande this case. She is from SMPT Ayurveda College, Igatpuri, Nashik. Dr. Pradnya.
Hello everyone, good evening. Just I correct my name. My name is Dr. Pradnya Deshmukh.
Yeah, sorry.
Yes. Shall I start?
Yes, ma'am, please.
Firstly, I discuss with the case. as she has mentioned all this case in detail, but I think there are some things which are missed in the case taking. So shall I correct them firstly?
Yes, yes. Please correct.
Uh, as she has mentioned, the patient has 9-month amenorrhea. Okay, but I think by standard protocol, we should mention it in weeks, whatever weeks, 36 weeks, 37 weeks, or whatever. Because we have to go for, we have to plan our strategy according to that. Then it's okay if she say 9 months. Next is she has mentioned obstetric. Yes.
Whenever you are, for students, please note, whenever you are reporting ANC case, mention in weeks. Okay.
Yes, that will be appropriate, more standard. Then obstetric history, she has said G2P1A0L1. That means the patient has one live child. So there is no any history of the previous pregnancy. Whatever she has mentioned is history of the first trimester, then second trimester. But we should know what her previous pregnancy had. Means is it was a cesarean section, or does she had any, did she had any PIH history, there was any eclampsia, or there was any complication regarding anything regarding baby or her pregnancy status. So we should know about that, and then only we can proceed further, because yes, it is good that she had given detailed history about the present pregnancy, but detailed history of the previous pregnancy is also important, definitely. Then abdominal examination she had did, but she has mentioned that abdomen distended. So we cannot say that abdomen is distended. Yes, abdomen is definitely distended, but we should mention that weeks, because we are doing obstetric examination. So we have studied that up to umbilicus, it is 24 weeks, then above that, then it is 28 weeks, and up to sternum, that is 36 weeks. So we should mention in that language. Okay. She had mentioned that FHS are at right quadrant, that are definitely okay. But she also said, she should say that how much weeks she can palpate on the abdomen. Definitely, that is necessary. Then next is USG. The report is given, which is 12th week. Ideally, ideally, a patient should do 5 times at least sonography as a first to elucidate or see the viability of the pregnancy. Then for the 12th week, so that is NT scan. Then afterward, anomaly scan. Then at 28 weeks, which is for status of the amniotic fluid, and afterward at least at 36 weeks. So recent sonography is necessary, I think. So all these things should be taken in consideration while taking any case. Okay. Madam. Hello, madam.
Yes, yes, ma'am. Please continue.
Am I audible? Yes.
Yeah.
Then we can see the BP, patient's BP is 128/86. So it is just a little bit a higher side. So we should take in consideration, but we cannot say that she has PIH, because just from one reading, we cannot say, we cannot label her as a pregnancy-induced hypertension, but we have to monitor her consequently for 6 hours or 8 hourly, so that if it is persistently increased, then we can say that yes, she may be landing PIH. So these all are the basic findings. Then about management, as she has complaint of abdominal pain, and yes, this is the main complaint. So we have to see, if she is completed 36 weeks, then we have to see what is the status of baby, and shall we further go for, if she is 37 weeks completed, then we can go for the let her go in labor, or if she is not completed 36 weeks, then we cannot go for a premature labor. So we have to stop the pains. Firstly, we have to assess, is it contraction, is she landed in labor. So firstly, we have to do her paravaginal examination, And if according to what is the status of cervix, then we can assess that is she is landing in labor, and shall we let her go in labor according to what is her gestational age, which can be calculated from her sonography. Okay. So if she is has passed 37 weeks completed and baby status is good, we should do one NST, and if everything is fine, we can let her go in labor and start according to that. But if it is not, we have to use tocolytic agents to stop the pains and let her stop, means not to let her go in premature labor. So this is the ideal approach to the patient according to my opinion. And anything, shall I go for the ANC protocol or ANC examination?
Yes, ma'am. Yeah.
Or anybody has questions can ask. Or rather, I will go directly to my presentation.
You can start your presentation, ma'am.
Shall I start?
Yes.
Just a minute. So my PPTs are visible?
Yeah.
Okay. So as we are discussing today the case of a ANC antenatal care patient, so I will mainly focus on the history taking ANC and its management.
Can you please make it in presentation mode?
They are not going forward.
Or okay.
Pallavi?
No problem. Please
Yes,
continue.
ma'am. They are not getting forward. It's just. Okay. Hello, ma'am. Shall I start now?
Yes,
Yes,
ma'am.
they are going forward. Yes. So my PPTs are visible. Okay. So according to our all the curriculum, definition of antenatal care, it is the systematic supervision of a woman during pregnancy. So it is examination and advice of to the woman. It's systematic. We have to see some things. We have to assess that her what is the status, and it is supervision. So we are examining and according to that advising whatever the need, what is the need to change in her daily routine or whatever the diet. So there is examination and advice. So that should be regular and periodic. Means according to our whatever we have advised in all our studies and all, we have to do first in first 6 months a 1 monthly checking of the patient, and after that for seventh and in 7th and 8th month we have to do checking of the patient, that antenatal checking for the up to means in the difference of 15 days, and after that we have to check patient weekly. So this is regular and periodic. We have to plan all this in the initially in the first visit only. So we have to advise patient that you have to come for that after this day, after some 1 month in the initially, and afterwards after 15 days. So it is periodic and regular. So what it is comprises, it is careful history taking and examination. We have to take detailed history of the patient, general and obstetrics, and as per time suggests, we should carry out the necessary investigations. And of course, according to her complaints, according to her situations, we have to give her advice appropriate advice. The aims and objectives of ANC checking are to screen the high-risk patient earliest and to prevent or to detect and treat at any complication, at any situation. And third is to ensure continued risk assessment and provide ongoing primary preventive health care. So first and most important is to screen high-risk patient, because patient, everything is fine to some extent, and afterward suddenly something happened and patient land in some complications. So this we have to screen at the earliest, so that we have to take the necessary treatment, necessary management according to that. So, and definitely if we can prevent that, then we have to take the necessary steps for that. Then objectives are to ensure a normal pregnancy with delivery of healthy baby from a healthy mother. Definitely, our most important objective is to ensure a normal pregnancy. The whole pregnancy period should be without any complication. The patient should enjoy her pregnancy and should and deliver a healthy baby, which should be more than 2.5 kg of weight. It should be very healthy. So in that aspects also. So definitely history taking, these are some terminologies which we use in our Ayurveda also. We all know about that. I won't take much time on that. That is complaints. What is the history of present illness, then present pregnancy? As I said, that present pregnancy history is important, but definitely previous pregnancy history is also important. So obstetric history, menstrual history, past medical history, all this history are very important. Family history, thus patients has her paternal and maternal family. If she is having any diabetes, hypertension, we have to take all this history. Then examination. First examination is definitely important, but consecutive examination we have to see what is weight, is she has pallor, is there is fetal edema. And firstly, we have to take weight, height of the patient, as we have to assess next that does she can have normal delivery. Is her height is so small that we there is the sacral promontory we can reach, so there can be normal delivery. So all these factors are to be taken in consideration at the first visit only. So weight should be examined in every visit of the patient. So pallor is definitely we have to see for to assess anemia. Then edema also is a very important sign to see, because there it is the symptom of PIH, pregnancy induced hypertension. As we all know, that is means edema, hypertension, and proteinuria. These all are important symptoms of PIH. So we have to assess this as early as possible. So whole systemic examination, does patient have from top to bottom, we have to examine patient. Does he have any oral complaints? Then other skin problems. So every systemic examination, in the sense, we should also see her heart sound. Is there any murmur, hemic murmur, or other symptoms? So we have to see all this systemic examination also. The next is obstetric examination. So obstetric examination, what it does say, we have to see the abdominal examination. Why abdominal examination is important? Because does it coincides with the USG? Whatever USG is saying 36 weeks, and we are not if we palpate the abdomen and it is not according to USG, or it is not 36 weeks and it is just palpable as 28 weeks or 32 weeks, whatever the examination, we have to take in consideration, and according to that there can be diagnosis as IUGR or other many other diagnoses can be there. If the abdomen is more distended than her whatever USG is saying. So if it is USG saying 28 weeks gestational age, the age is of the baby, and we are we find it as a 32 weeks, then it may be suggestive of something like polyhydramnios. So all this to make clear about what is the status, we have to do obstetric examination very thoroughly. So this is very important. Then routine investigations. We all know the ANC profile, that is starting from the initial, that is CBC, then all HIV, VDRL, HbSAg, blood group, and urine routine, BSL fasting PP. So all these routine investigations should be done firstly in the at least at the 8th week, and if after 2 months, the at least CBC should be regularly checked. So if necessary, other investigations should be done, but at 28 weeks we should do BSL fasting PP for the status of if patient is developing diabetes mellitus. So we have to see that. Then special investigation, as I said, they are also important. Then antenatal advice. What is the principles? Definitely, they are the first to counsel the woman about the importance of regular checkup. These are very important when we work in rural area. Patients are not aware of their health and not aware of their baby, whatever the consequences, they are not educated about them. So it is very important to counsel them that regular checkup is very important. We can counter the problem, we can counter the complication at the earliest and make the proper treatment. So next is to maintain and improve the health status of women to optimum till delivery by judicious advice regarding diet, drugs, and hygiene. So diet is very important. We will speak about that in the next slides. The third, to improve psychology and remove the fear of unknown by counseling women. Many women have some stigma in their mind that we can see the 2 ages, like once somebody thinks like it is like a disease, or somebody are very unaware of that. So those 2 points should be corrected, means we have to improve their psychology, and they should be aware of their pregnancy and should be positively aware of that. So if there is any complication or if any symptom they are neglecting, we should tell them that you should not neglect that like this. If there is PV bleeding, if there is a fetal edema, which is to a great extent, we have to say tell them that it is important to tell us or take consultation of the doctor. So this is all about what our standard protocol according to our Ayurveda, according to government or the allopathy, we can say the modern science we follow, which is very important. But what Ayurveda says, what Ayurveda is contribution in that sense. So Ayurveda has explained the Garbhini Paricharya to a great extent. So they have said that what she should eat, what she has, what her behavior should be, what she should do, or everything. So this we can divide in basically Garbhini Paricharya, then what we should give her medicine, and Garbha Sanskar, which is a very important in these days. So what Acharya Charak says that evam purvatihi arogya bala varna samvahan sampadam upvetam in janati shreshtham apatya janayati. So all this, whatever Charakacharya has advised, it gives arogya bala varna samvahan to the apatya. So whatever what all these things are explained in Charakacharya to the Garbhini, they are very important to get a healthy progeny. So I will just enumerate or take in a small shortly what they had said, that in first 3 months they had advised Charakacharya and Sushrutacharya the use of cold and sweet liquid diet, as in the first 3 months Garbha is not it is not in a solid condition, so it is not sthira in our Ayurveda language, it is not stable. So for that we have to give her cold and sweet liquid diet or milk, and also it will correct the dehydration which is due to vomiting, and it is also necessary to supply her nourishment. So other than this, Madhura group means Shatavari, Ashwagandha, all these drugs, or Yashti Madhu, these drugs are very helpful, or these are herbal drugs are very helpful for a pregnant woman. So they also being anabolic help in maintenance of proper health of women. So they are also important. This Dravya Siddha milk, if given to a pregnant lady, that will help to help her also and to the baby. Then next is Garbha Poshan should be there. So everything with Gruta or butter, and Ghruta means ghee. These all should be used extensively in all the 7 months or the till delivery. In fourth month, it is advised that milk and butter. By Charakacharya has said that in butter should be given in a 10-gram amount, which is taken from milk. So this is also important. This has very good good effect on the baby. And Sushrutacharya has explained that in this month, meat soup should be taken. So this this will help to get the muscle or the as we know it has protein content more. It will help to nourish the baby. So and also to stable the garbha. So these all things are very important in fourth month. Since then, specifically Sushrutacharya has explained that in fifth month, Balya Dravya should be given, which gives nourishment to the baby. So various Ghruta has been explained in our Samhitas, and they should be given to Garbhini, because Garbhini becomes crucial, that is thin, and Garbha is because all the supply goes to Garbha, and so we have to give to increase volume of Rakta and Mamsa in Garbha. So we should give such medicines that will help to fetus. So there are definitely we know the needs of fetus has increased. So Balya Dravyas like milk Ghruta should be given, and they are Siddha, means they are boiled with medicinal drugs like Gokshura and Krishniparani. So in 6 months, Charakacharya, Sushrutacharya has said that Buddhi, means intellect, develops. So there Krishniparani Siddha Ghruta is advised in the 7th month, but Gokshuru Siddha Ghruta is advised as this month we see that patient many times have complaint about edema, pedal edema. So Gokshur, which is a good diuretic that will prevent water retention, and it will help complication like a PIH or preeclampsia. So these all they have thought with so many considerations. So after so much study, so Ghruta is ideal for improving intelligence, memory, and integrity. So digestion. So this is advised in all almost all the months. So in the 7th month, Kikvis, that is triagravidarum, has we can see in patients, and to relieve this symptom, there are so many tail, Ghruta, which are advised, which can be applied on abdomen, and we have seen that various studies or various research projects are being done. They have excellent results. So all this should be done in according to our Samhita. They have different opinions, Charaka and Sushrutacharya, but I have enumerated in between. Whatever the thinking of that Granthakaras, Samhitakaras is more important. So these medicines also have, there are many research studies done on these medicines, and they have proven having very good results. So also in 8th and 9th month, in Paricharya has said that Yavagu prepared from milk should be taken, and Anuvasan Basti. As we all know, there is Basti, that is enema, which is medicated quath or medicated oil. So Anuvasan Basti is with oil, prepared with drugs like of Madhura group, and vaginal tampons are advised. So 8th month is very important. In this month, many times patient has complaint of constipation, so we can advise them to have Anuvasan Basti, and this Basti is very important to make the passage of the labor passage or the pelvic organs. So all the cervix and vagina, this passage becomes very they becomes more elastic, or it helps according to Ayurveda. The Vata Anuloman is done, and it softens the vaginal passage. So this will help for a normal labor. So the tampons of oils plays very important role in the last 9 months. So and Basti of Anuvasan Basti, we gave Matra Basti, which is in less amount, that is 60 ml enema of a medicated oil is given in the 9th month, which is not given regularly, but after 6 days, or many Vaidyas give it alternate day, but that will definitely help for a normal labor. So these are the some important things explained in our Ayurveda. So this is according to ahar, what is vihar, but garbha sanskar, which plays very important role for a healthy progeny in the aspect of intelligence, in the aspect of every her activity, babies. So garbha sanskar, we can take a separate lecture on that. But yes, garbha sanskar is a very important part of our garbhini paricharya. So I cannot stay it apart from garbhini paricharya, because as garbha and samskaro gunantaradhana means we can make a better progeny, a healthy, intellectually better progeny by using garbha sanskar. So this is one of the, I think, a boon of Ayurveda, which has given to the world. So garbha sanskar, definitely we can have a separate lecture on that. So these all things are very important, and I have just shortly enumerated all these things. We can definitely make another big lecture on Ayurvedic paricharya only. But yes, thank you very much for giving me opportunity to share my views on this ANC. And if anybody have any question, please.
Thank you, ma'am. Thank you, Dr. Pradnya Deshmukh, ma'am. And so, Garbhini Paricharya, Masanumasic Vritti, and Garbha Sanskar. These are the specialty areas of Ayurveda. And definitely, we should plan treatment considering these Ayurveda parts or modules. So now, to discuss homeopathic part, we have Dr. Trupti Devrukar. She is Associate Professor and HOD, Gynec Department, Srimati CMPHM College, Vile Parle, Mumbai. Dr. Trupti. Dr. Pradnya,
Yeah.
please. Yeah.
Yeah, hello. Good afternoon. Good evening to all.
Good evening, ma'am.
Yeah. So it was a very nice presentation. A few points that I would like to say is that whenever you are presenting a history, antenatal history, we also need to present first the positive part, the positive history. Then we are going to talk about the negative history. So when I say positive history, over here, she should have mentioned where is the pain, when did it start, whether it is, and differentiating it from labor pain definitely is very, very important. Or is she having the pain due to some other reason? It could be anything, any medical surgical illness which is causing that pain. So when we have a ANC case coming up with some complaint, diagnosis is the most important keyword, so that we should not miss out any other medical or surgical disease also apart from pregnancy. So a little more description about the ODP, onset, duration and progress of that pain would have helped. And the examination part also, fundal height, I think madam has pointed out everything which is required for the examination, which was very crucial. Now, when I'm going to just give you a little brief idea about the homeopathic system of medicine. It is in line with, I think, almost all of us are first doctors, and then we are going to practice the pathy that we are. Okay, so the diagnosis of pregnancy definitely depends on your history, the signs, symptoms, and investigations. So it is like any other field of medicine that we diagnose pregnancy. Now, the treatment part that is a little different in homeopathy is that we don't have something like a common medicine which can be given for all complaints to a patient. Like, for example, if I can give you a simple example is, if a patient has fever, crocin is the commonest medicine which is given or taken by the patient. Whether it is any fever, it will definitely help in bringing it down. So now, here we don't have a particular medicine which can be given for fever. So we have 10 different medicines, and our pathy is going to speak, it's an individual pathy where we are going to consider the diagnosis of the disease plus the diagnosis of the patient. So like we are going to consider the temperament of the patient, what the past history, the family history, the susceptibility, everything apart from his physical complaint. And this will help us in giving the patient a particular specific remedy, what we call as an individual remedy or a constitutional remedy. And the patients usually respond very well to such remedies. Now, in pregnancy, if we consider backache during pregnancy, now this backache, which is one of the very common complaint that females develop during pregnancy, that is backache. Now, this backache could be because of sciatica, it could be because of postural problem, or it could be referred pain. It could be just simple exertion which is causing her that pain. So there are different causes underlying this backache. Now, when I need to address this patient from homeopathic point of view, I will be considering her physical complaints, try to get to know what is causing the pain, and then give her the remedy. So a patient with sciatica will require a different remedy. A patient who is having this pain due to some postural defect, or it's having due to lifting heavy weight, she's going to require a different remedy. So the diagnosis is also very, very important. And we follow the normal WHO guidelines for antenatal care related to the ANC visit, related to the examination of the patient, the investigations that are required. Yes, minimum 5 sonographies is the protocol nowadays. And we also have to every time ask the patient whether they are taking the supplements or no. Because many of the patients just take for few months and then just stop it due to some or the other reason. कि मेरा weight ज़्यादा बढ़ जाएगा or something like that. Calcium लेने से I'll become obese. It's not required. I'm eating very healthy food. So we need to see that the dietary part and the supplements are properly followed by the patient. So any patient who comes for the antenatal visit, I think special time should be given to them, and we need to inquire about their dietary habits, the nutrition part, and whether they are taking the supplements or no. And tetanus immunization as per the schedule is definitely required, and registering them so that ideally we tell the patient to register herself in whichever hospital she wants to deliver before 7 months, because last minute she doesn't have to run from one hospital to the other, because many hospitals refuse the last minute admission. So it is always better that we ensure that a patient has been registered in a hospital, be it your hospital or any other hospital. Many a time patients just come for ANC visit till 7 months and then they go to their mother's place for delivery. So we have to consider all these things as well. And we can give them a letter stating their pregnancy progress, so that when they go for registration to any other hospital, it is very easy for that doctor also to understand. Then segregating the patients as high risk group is also very important. So if we have a high risk pregnant patient, special antenatal care, special attention is required for these patients, and delicate and sensitive handling also, especially if it is a bad obstetric history and she's conceived, or if it is a IVF patient who is pregnant, or a patient who has a Down syndrome baby and again she's pregnant. So all these are, they require a more sensitive handling, more comfort, more counseling apart from the medicine. And I believe the counseling coming from their doctor is much more helpful and motivating for them. So apart from our routine, regular antenatal advice, we have to also motivate them and encourage them, and keep them, tell them to think positive. So positive thinking, meditation also go a very long way in dealing with difficult pregnancies.
Yeah, thank you so much, ma'am. If anybody having any query regarding ANC, because today is last day, discuss ANC. can ask two experts. We have two experts today. Dr. Asmita,
Yes, ma'am.
have you noted everything?
Yes, ma'am.
Yeah. If you have any query, you can ask. Okay. So I think we can stop here now. Thank you so much, Dr. Asmita, Dr. Pradnya, and Dr. Trupti, and all audience.
Thank you.
So much.
Thank you, ma'am.
Thank you.